Welcome to NCLEX PN exam practice test. Our topic today is musculoskeletal. Use the link in the description to download the app on the App Store for free practice tests. Number 1. A client with emphysema has an order for Elixophyllin, theophylline. What is the desired action of theophylline for a client with emphysema? A. Reduction of bronchial secretions. B. Decreased alveolar spasms. C. Restoration of bronchial compliance. D. Relaxation of bronchial smooth muscle. The correct answer is D. Relaxation of bronchial smooth muscle. Explanation. Elixophyllin, theophylline, is a bronchodilator that acts to relax bronchial smooth muscle. Answers A, B and C are incorrect because they are not actions of theophylline. Number 2. Which snack selection by a client with osteoporosis indicates that the client understands the dietary management of the disease? A. A glass of orange juice. B. A blueberry muffin. C. A cup of yogurt. D. A banana. The correct answer is C. A cup of yogurt. Explanation. The food with the most calcium is yogurt. The others are good choices, but not as good as the yogurt, which has approximately 400 milligrams of calcium. Therefore, answers A, B and D are incorrect. Number 3. The LPN is assigned to care for a client with a fractured femur who is in skeletal traction. Which finding should the LPN report to the charge nurse? A. Presence of petechiae on the chest. B. Ecchymosis on the site of the injured leg. C. Oral temperature of 99.2 degrees Fahrenheit. D. Complaints of level 2 pain on a scale of 5. The correct answer is A. Presence of petechiae on the chest. Explanation. The presence of petechiae on the chest is associated with emboli, which needs immediate intervention. Answer B is incorrect because ecchymosis is common following fractures. Answer C is incorrect because a low-grade temperature is expected because of the inflammatory response. Answer D is incorrect because level 2 pain is expected in the client with a recent fracture. Number 4. Which of the following instructions should be included in the teaching for the client with rheumatoid arthritis? A. Avoid exercise because it fatigues the joints. B. Take prescribed anti-inflammatory medications with meals. C. Alternate hot and cold packs to affected joints. D. Avoid weight-bearing activity. The correct answer is B. Take prescribed anti-inflammatory medications with meals. Explanation. Clients with rheumatoid arthritis should exercise, but not to the point of pain, and not when inflammation is present, so answer A is incorrect. Anti-inflammatory drugs should be taken with meals because they cause stomach upset. Alternating heat and cold is not necessary, so answer C is incorrect. Warm, moist soaks are useful to decrease pain. Weight-bearing activities such as walking are useful, so answer D is incorrect. Number 5. A 54-year-old client is being treated for gout. Elevated findings on which laboratory test typically validate a diagnosis of gout? A. Creatinine clearance. B. Blood urea nitrogen. C. Serum uric acid. D. Serum calcium. The correct answer is C. Serum uric acid. Explanation. An elevated serum uric acid level is diagnostic among clients with gout. An elevated serum creatinine clearance and blood urea nitrogen level are indicative of renal failure. Serum calcium is elevated in hyperparathyroidism, primary cancers such as Hodgkin's disease or multiple myeloma, and bone metastasis. Number 6. The client using a diaphragm should be instructed to do what? A. Refrain from keeping the diaphragm in longer than 4 hours. B. Keep the diaphragm in a cool location. C. Have the diaphragm resized if she gains 5 pounds. D. Have the diaphragm resized if she has any surgery. The correct answer is B. Keep the diaphragm in a cool location. Explanation. The client using a diaphragm should keep the diaphragm in a cool location. She should refrain from leaving the diaphragm in longer than 8 hours, not 4, so answer A is incorrect. She should have the diaphragm resized when she gains or loses 10 pounds, so answer C is incorrect. Answer D is incorrect because the client should be resized if she has abdominal surgery. Number 7. What is the primary purpose of using a CPM machine for a client with a total knee replacement? A. Prevent contractures. B. Promote flexion of the artificial joint. C. Decrease the pain associated with early ambulation. D. Alleviate lactic acid production in the leg muscles. The correct answer is B. Promote flexion of the artificial joint. Explanation. The primary purpose of the continuous passive motion machine is to promote flexion of the artificial joint. The device should be placed at the foot of the client's bed. Answers A, C and D do not describe the purpose of the CPM machine, therefore, they are incorrect. Number 8. Which early morning activity helps to reduce the symptoms associated with rheumatoid arthritis? A. Brushing the teeth. B. Drinking a glass of juice. C. Drinking a cup of coffee. D. Brushing the hair. The correct answer is C. Drinking a cup of coffee. Explanation. Holding a cup of coffee or hot chocolate helps to relieve the pain and stiffness of the hands. Answers A, B and D do not relieve the symptoms of rheumatoid arthritis, therefore, they are incorrect. Number 9. The nurse is caring for a client admitted with multiple trauma. Fractures include the pelvis, femur, and ulna. Which finding should be reported to the physician immediately? A. Hematuria. B. Muscle spasms. C. Dizziness. D. Nausea. The correct answer is A. Hematuria. Explanation. Hematuria in a client with a pelvic fracture can indicate trauma to the bladder or impending bleeding disorders. Answers B, C and D are incorrect because it is not unusual for the client to complain of muscle spasms, dizziness, or nausea following multiple traumas. Number 10. The client with a cervical fracture is placed in traction. Which type of traction will be utilized at the time of discharge? A. Russell's traction. B. Buck's traction. C. Halo traction. D. Crutchfield tongue traction. The correct answer is C. Halo traction. Explanation. Halo traction will be ordered for the client with a cervical fracture. Russell's traction is used for bones of the lower extremities, as is Buck's traction, so answers A and B are incorrect. Crutchfield tongues are used while in the hospital, and the client is immobile, so answer D is incorrect. Thanks for watching. Don't forget to like, share and subscribe to our channel for updated videos every week.